Hello. First of all, ladies and gentlemen, I would like to take opportunity to introduce myself. I am Dr. Andrzej Januszewicz from Department of Hypertension of National Institute of Cardiology in Warsaw, Poland. I would like to thank organizers for your kind invitation for 2022 meeting on cardiometabolic diseases, obesity, and diabetes. And thank you very much for giving me opportunity to overview the topic of hypertension control, cardiovascular risk factors, and diseases in the post-COVID-19 era. Today, I would like to split my talk into 4 consecutive parts, and let me start from part 1, from the impact of COVID-19 pandemic on cardiovascular risk factors in patients with hypertension, and also I would like to share experience of our European Society of Hypertension in this field. Please note that emergency lockdowns over past 2 years initiated in countries across the globe affected daily life, particularly health, well-being, and social and economic aspects, and impact of COVID-19 on cardiovascular risk factors can be divided into negative and of those having beneficial effect. Well, let me start from the impact of COVID-19 pandemic on physical inactivity. And we all know from the classic study evaluating physical activity across the globe that COVID-19 related lockdown caused a decrease in physical activity all over the continents, what may be translated on the estimated increase in blood pressure by almost 7 millimeters of mercury. Please also know that COVID-19 restrictions and lockdowns affected physical activity across the globe in all major big cities in the United States, Asia, Australia, and Europe. We also know from recent studies that even short-term inactivity noticed during COVID-19 pandemic over 2 years may be linked with increased cardiovascular risk factors and, in consequence, with detrimental impact on cardiovascular function and structure. Now, I would like to give a few words on the impact of COVID-19 pandemic on food consumption, and we also know from longitudinal cohort study performed in the United States that the first wave of COVID pandemic resulted in increased food consumption, what may be translated into approximately 3.3 kilogram weight gain every month noticed in males and in females in the United States. We also know that in 3 countries, including Austria, Great Britain, and Poland, self-reported increase in body mass in women was almost 40%. And we also know that people in Austria, Poland, and Great Britain started to purchase frozen food with long shelf life and rich in grains, fats, vegetables, and sweets. Now, a few words about impact of COVID-19 pandemic on alcohol consumption. And we know that the frequency of alcohol consumption, for instance, in the United States, increased by 14%. We also know that in Europe increased, for instance, in Great Britain by more than 34%. And of note, alcohol consumed 1 day more per month was noticed in 3 out of 4 adults. Also, increased alcohol-related problems being independent of consumption level was noticed in almost 10% of women in the United States, and also we had the for Europe. And also commenting alcohol consumption increase, we should summarize that particularly specific groups are vulnerable for increased alcohol consumption, including essential workers, older individuals, parents with children, and those with higher degree of depression. And also, finally, we know that indices of drinking severity in the United States, in Europe, and in Australia are significantly and positively related to the depression and also anxiety severity. Again, I would like to comment the impact of COVID-19 pandemic on depression, anxiety, stress, and sleep. And available study documented that the mean sleep duration increased during COVID-19 pandemic and all consecutive lockdowns. However, this is associated with decreased sleep quality and increase in prevalence of insomnia. For instance, in the Italian population, we notice poor sleep quality in more than 50% of responders, who also reported very often high anxiety and high distress. So, taken together, COVID-19 pandemic is severely affecting the cardiovascular risk factors, but on the other hand, let's summarize the impact of COVID-19 pandemic on air noise and pollution. We know from a very interesting study that temporary reduction in daily global CO2 emissions was observed during COVID-19 pandemic. And please note that the estimated decrease in daily fossil CO2 emissions from the severe and forced confinement of world population were decreased by almost 17%. Also, we noticed a very beneficial effect of COVID-19 pandemic on aircraft and other transportation noises. And please know that our study performed in Poland, in Krakow, clearly documented that even short-term reduction in aircraft noise exposure observed during COVID-19 pandemic has beneficial effect on blood pressure and target organ damage and may reverse unfavorable effects caused by exposure to aircraft noise seen and observed before COVID-19 pandemic. This may be explained by the reduction in sympathetic drive, decrease in renin activity, renin-angiotensin system activity, and also such a reduction in the transportation noise observed during COVID-19 pandemic is profoundly affecting inflammation, which is increased during exposure to transportation noise. So in summary, and summarizing the first part of my talk, we may conclude that COVID-19 pandemic exerts both in a short and long-term impact of lifestyle, behaviors, and environmental changes affecting blood pressure control and cardiovascular risk factors, also responsible for the development of hypertension. Now I would like to switch to the second part and very briefly comment follow-up of patients with hypertension during COVID-19 pandemic. And we all know from an excellent study of our colleague Thomas Weber from our Council of European Society of Hypertension who explored the impact of hypertension care in the 52 excellent centers across Europe. Our survey clearly showed that during the first wave of COVID-19 pandemic, the number of physically attended visits by patients with hypertension was reduced by almost 90%. And also, please note that 57% of excellent centers suspended ABPM in hypertensive patients. This was compensated with a substantial increase in regularly performed HBPMs. Also, the second part of excellent center surveys clearly documented that diagnostic and therapeutic procedures related to hypertension were dramatically reduced during the first year of COVID pandemic, with the largest reduction during the first lockdown. And also please note that this is particularly referring to the number of imaging procedure and biochemical evaluations. So taken together, when discussing the management of hypertensive patients during the COVID-19 pandemic and beyond, we should definitely understand the need for development of new strategies for care of patients based predominantly on teleconsultations. And now, and almost finally, I would like to switch to the topic covering the COVID-19 pandemic and its impact on blood pressure values. Please note that factors affecting blood pressure control in patients with hypertension during COVID-19 pandemic are multifactorial, and they include delayed medical care, already discussed change in risk factors for increased blood pressure, non-adherence to antihypertensive therapy, and they are also including many other factors. Let me now switch on the short-term effect of COVID-19 pandemic on blood pressure, and I already presented the impact of COVID-19 on cardiovascular risk factors, including physical inactivity, decreased sleep quality, the increased number of depression, and also factors including increased alcohol intake and increasing obesity. Please also note from the study performed in 2010 that depression is one of the most important factors promoting hypertensive crisis, and this may be translated to clinical practice. And please note, one of my colleagues, my neighbor, who is a 62-year-old man with higher education, he's an economist, and during the first wave of the pandemic in March of 2020, he was complaining of sleep disturbances, work-related stress and panic attacks, just evoked by the first lockdown. And please note, he had a history of normal blood pressure values, and 3 weeks after the introduction of the lockdown in March 2020, he was consulted by me, and severe increases in blood pressure up to 180 millimeters of mercury over 120 were noticed. Please note that on the same day, he had normal values of blood pressure as confirmed by ABPM, and it was a classic example of the impact of COVID-19 on blood pressure in relation to insomnia, increased stress, and fear. So please note that COVID-19 has a profound effect on short-term blood regulation, and also we know that SARS-CoV-2 infection is also affecting blood pressure, and in some of patients with post-COVID-19 sequelae, we are observing increases in blood pressure or problems with blood pressure control under antihypertensive treatment. And let's currently discuss a long-term effect of COVID-19 on blood pressure, and the data so far are scant. We have two studies available. The first study coming from Gianfranco Parati group from Italy clearly documented no change in blood pressure profile in patients during COVID pandemic as compared to pre-COVID time. However, the study is based on a relatively small group of hypertensive patients, and also please note that blood pressure was recorded by means of home blood pressure measurements. The second study of Lafemme and colleagues coming from the United States evaluated home blood pressure values in a large group of patients, and this study, in contrast to the Italian one, documented a severe increase in both systolic and diastolic blood pressure in patients subjected to all restriction of COVID-19 during all consecutive waves as compared to the period before the start and the beginning of COVID-19. And also, taking this occasion, I would like to briefly discuss already started the ESH-ABPM COVID-19 study, which is based on ABPM recordings. This is a very and being based on ABPM recording. Our ESH-ABPM COVID-19 study recruited almost 40 hypertension centers from all Europe. We have a scientific steering committee, executive committee, and coordinating center of this study, and we do hope to complete and to obtain the first result pretty soon in September 2022. And let me finish with COVID-19 and cardiovascular complications. And also, I would like to briefly present the results of two registries, Capacity COVID Collaborative Consortium and LEOS study group. And in conclusion, we may conclude that considerable heterogeneity exists in the strength of association between heart disease subtypes and mortality, and of all patients with heart disease, those with heart failure are of greatest risk of death. And also please note that besides pulmonary embolism, serious cardiovascular complications are rarely diagnosed during hospital admissions during the COVID-19 pandemic. And finally, I would like to focus on some unusual and rare cardiological manifestations of COVID-19. We observed Takotsubo syndrome and also acute myocarditis presenting as a reverse Takotsubo syndromes in patients with SARS-CoV-2 respiratory infections, And also we have a growing number of reports of spontaneous coronary artery dissections. So in summary, and concluding, COVID-19 has an impact on the risk factors affecting short and long-term blood pressure control. The short-term effect is documented so far in subjects with stress and depression and in post-COVID sequelae. And as documented, a long-term effect should be the subject of further studies, including our ESH ABPM COVID-19 study. Thank you very much for your attention, and again, thank you very much for inviting me to this excellent symposium and to such interesting session. Thank you and goodbye.